Hello students, welcome to this session. So we are basically going to talk about asthma as a respiratory disorder. Okay, specifically the lower respiratory disorder. So now in this session we are going to focus on some areas like the definition, the pathophysiology as well as classification, then causes, then signs and symptoms, and then we are going to medical management and some investigations. Then we are going to conclude with a nursing management. Okay, so now let's have an overview of asthma by the World Health Organization, specifically 2025. So this is an updated version on World Health Organization, the thought of World Health Organization on the condition called asthma. So asthma is described to be a major non-communicable disease affecting both children and adults, and it is the most common chronic disease among children. Okay, so now with asthma we are saying that inflammation and narrowing of the small airways in the lungs causes asthmatic symptoms. So basically by World Health Organization they say most symptoms of asthma are caused by the inflammation and narrowing of the small airways, because this is basically the respiratory disorder. And most of the time, and most of the I can talk about the major thing that happens in asthma is the inflammation that leads to the narrowing down of the small airways. So now due to this inflammation and narrowing down, we are going to look at the pathophysiology in a simple in a simpler way. So this inflammation and narrowing of the small airways is what leads to all the signs and symptoms that the patient is going to manifest with. For example, someone can have cough, wheezes, and shortness of breath, including chest tightness. These are classical signs and symptoms of asthma. So we mean to say, in case someone presents with asthma, in case someone presents with these signs, cough, wheeze, shortness of breath, and chest tightness, these are more likely to tell a health practitioner that someone might be suffering from asthma. Okay. So now, let's look at the definition of asthma. What is asthma? How are we going to define asthma? I always recommend to say when you are giving a definition, there is a standard way of following something up. So what is the standard way of following something up? We said you need to talk about a condition. Is it a chronic or acute? And what specific part of the system, what system does it affect? And then you can give some signs and symptoms or any complication. If you give the definition in that particular way, then you are well and good. So for example here, the definition of asthma is saying asthma is a chronic. This means it's a disease that lasts for a long period of time. So it's a chronic inflammatory disease of the airways, because when you say airways, we mean it is a respiratory disorder that causes narrowing and the swallowing of the bronchial tubes, leading to difficulties in breathing. So now when you look at this definition of asthma, even you yourself, if you are marking, you can give someone 5 marks. Okay, so this is the definition of asthma. We're saying it's a chronic inflammatory disease of the airways that causes narrowing and swallowing of the bronchial tubes, leading to difficulties in breathing. So now let's look at the pathophysiology of asthma. When we're basically focusing on the pathophysiology of asthma, then these are normal. This is the normal respiratory tract, specifically the bronchioles. Under normal circumstances, the normal bronchioles, they should be wide open, as you can see here. They should not have any obstruction like mucus production and everything. Okay, this is the normal bronchiole, and it is well dilated so that it can accommodate more air, so that the breathing out and breathing in becomes easier. But this is not the case in case of asthma. Okay, in case of asthma, these tubes is narrowed down due to some causes, of course. And then when you look at this same tube, it's not only causes the narrowing down, but also leading to the mucus production. So the mucus production is going to occur because of the inflammation process. And the inflammation process is going to occur because of the triggers, like in case of cold weather, or in case of dust, in case of someone is allergic to some kind of salt. So all those are going to be the triggers, and they are risk factors, or rather the causes of asthma. So they are more likely to lead to this final result that we can have here. So the normal airways, look at them. The passage of air is actually simple, so this supports breathing. But in case of asthma, they are obstructed airway passages. You understand, there is constriction. Then this can easily make someone to do what? This can easily make someone to have difficulties in breathing, as you can see. So now, let's narrow down the pathophysiology of asthma. Remember I said, from the pathophysiology, we are able to get the signs and symptoms of a particular disease. Because in the pathophysiology, you're just looking at the disease process. If the disease process is affecting the legs, you can't expect someone to have headache. No, they need to have pain in their lower limb. That's what we mean. Okay? If the disease process is affecting ears, why should someone complain of legs? You understand? So the pathophysiology is what leads to what someone is going to complain of. That's basically what we mean. You understand? So now let's go to the summary of what I've been explaining here. So basically, in the pathophysiology of asthma, it's just that under normal circumstances, the airways should be patent, meaning they should be wide enough to accommodate air. But in case of asthmatic attack, due to some triggers like cold weather, allergic reactions, or maybe in case of family history of asthmatic attack or anything, this leads to obstructed airways. And that's basically about the pathophysiology. Now let's look at step by step. This is going to lead us to know the signs and symptoms of asthma. So in the pathophysiology, we are saying there are triggers in the environment. These triggers, we can have dust, we can have pollen grains, we can have allergic reaction, anything you are allergic to. Whenever this thing gets into the airways, they are going to cause airway immune response. You know, the immune response, inflammation is always there. So if airways immune response has been activated, then this particular immune response is going to cause inflammation, because the process of inflammation, we're trying to recruit what we call white blood cells so that they can come and fight this particular infection or whatever that has been presented. You understand? So this inflammation is going to cause to tighten the bronchial muscles. That is going to lead to bronchoconstriction. After bronchoconstriction, remember these same triggers, it's about inducing the leukotrienes, inducing the interleukin and everything. Those are the major mediators of mucus production in the goblet cells of the airways, of the air system. So now there is going to be mucus production. Once mucus has been produced, then airway is going to narrow down. How? Because there's vasoconstriction, or bronchoconstriction rather, bronchoconstriction of the airways, and then there's also mucus production. So this is going to narrow the airways. Then air is going to be trapped, meaning the excretion and the expiration and inspiration is going to be affected, then leading to signs and symptoms, e.g. some classical signs and symptoms like wheezes, cough, such things, shortness of breath. Those are classical signs. These are coming due to this pathophysiology, what I've explained here. So now let's try to look at the classification of asthma. basically the classification of asthma, they are just based on what I can say. The classification of asthma are based on the cause, like the cause of an asthma. So when we look at the classification of asthma, we have extrinsic asthma, we have intrinsic asthma, and then we have mixed asthma. So what do we mean when we say extrinsic asthma? With extrinsic asthma, usually this is denoted to be an allergic asthma. Why? Because this type of asthma is mostly caused by what has been presented in the environment. For example, dust, pollen, animal fur, smoke, or certain foods. These are going to stimulate the airway immune system. Once airway immune system has been stimulated, then you know what follows. Okay? So now, if the immune system has been stimulated, this what I was explaining there is going to cause inflammation, narrowing down, etc. So the extrinsic asthma is most common in children and people with family history of allergics. Mostly children is that they are mostly exposed in this environment. For example, they are playing around in the plants, everything, vegetation. So they get to be they get to be easily stimulated, and they are mostly exposed to these particular pollen grains because they are playing around and everything. You understand? They are all over, maybe exposed to smoke, just like that. Then we have intrinsic asthma. This one is called a non-allergic asthma. Why? Because this intrinsic asthma is not caused by what has been or what has been presented on the environment. Let's say what we are talking about, allergic reactions. No. Okay, it's a non-allergic asthma because it deals with something like stress. Stress has nothing to do with allergic reaction. Cold air has nothing to do with allergic reaction. Cold air just going to it's going to cause bronchoconstriction. The respiratory infection has nothing to do with allergic reaction, and exercise, even emotions. Okay, so this one is more common in adults because this one is more like it's on some things that are non-modifiable by adults. You understand? For example, stress is always there for adults, emotions are always there for adults, and adults exercise more often. Okay, so this is known for adults. And then the third classification of asthma is that it's the combination of both. It could be allergic or non-allergic. Okay, so a patient may react to allergens or also irritant like cold weather. So this now is making it to say this is the combination of asthmas. Okay, so from there we are going to the classical signs and symptoms of asthma. When you look at the classical signs and symptoms of asthma, we are basically looking at what are some of the signs and symptoms. When you look at them, you can tell that this is more likely to be asthma before you can even confirm it. So we have dyspnea, which is difficulties in breathing. We have wheezing. Wheezing is a high-pitched whistling sound, the way you hear the whistle. But when you are near this particular patient, you get the same sound of whistle, but it's going to be high-pitched. Okay. Then we have cough. If someone is coughing more often, you understand. So now we go to the general signs and symptoms. These general signs and symptoms are away from what we are talking about. However, dyspnea, we are going to include it because the classical sign. Wheezing, we are also going to include it. Chest tightness and coughing, especially at night or early morning. Increased mucus production. Then you just know that this particular person might be asthmatic. Okay, so now with the medical management of asthma, you just follow what the patient is suffering from. What do I mean? Look at the pathophysiology. We've looked at the pathophysiology, what is happening. So the major problem, the major issue in asthma is that there is an inflammation. This inflammation is not a burden to the person. It is coming as as a defending mechanism to defend the body. So it comes and narrows down the bronchioles. That's bronchial. That's bronchoconstriction. Now we have one problem here, bronchoconstriction, meaning we're also reducing the amount of where this particular person can accommodate. So we need to solve that. So note it down, we need to solve bronchoconstriction. Apart from that, what is the bronchoconstriction going to cause? Bronchoconstriction is going to cause difficulties in breathing. Then now, what happens? There is going to be mucus production. Why mucus production? This mucus production is going to be due to the fact that the activation of leukotrienes. These leukotrienes are the ones which activate the goblet cells so that they can release more mucus. So we want to solve that issue as well. So now let's try to look at this. Under medical management, it's very much important that you advise the patient to avoid triggers like smoke, allergens. If you know that they are exposed to them, you need to make sure that you avoid these particular triggers. Okay? And then, apart from that, you need to make sure that there are medications like reliever, short-acting bronchodilators. We want to dilate the bronchioles because it's a problem here as well. For example, salbutamol. You need to give salbutamol. This salbutamol can be given in different formulations. It can be given as a tablet, it can be given as an inhaler, or it can be given in a nebulized state. I'm going to explain all this. Okay? So as a salbutamol is going to come as a tablet. You are going to use it depending on the situation of the patient. In case they are in asthmatic attack, you can't give a tablet. You need to give them something like a nebulizer or an inhaler. Then we have some controllers. These controllers are inhaled corticosteroid. They are anti-inflammatory. They are long-acting bronchodilators like leukotriene modifiers, because leukotriene is the one which is causing the production of mucus. So if we control the leukotriene, then what is going to happen? So the leukotriene modifiers, what basically they do is they are going to reduce mucus production. Okay, so this was part of the medical management, basically using medication. So some of the nursing management, they are just going to include like you are just going to do general management and then focus on the disease a little bit. For example, things like positioning of the patient, maintaining a clean environment because there might be irritant there, observations and everything, you understand. So now the one I was talking about, to say you can either use a nebulizer or an inhaler. A nebulizer is something that looks like this. It and has a mask. Then you put medication here. Then it's steam that goes into the patient. Then they get to be that particular medication. Then we're talking about something like an inhaler. It's particularly something that looks like the one here on the light, and you put medication here so that they get it, like they get in terms of steam. So basically, these are the two instruments that I was talking about. We have the nebulizer. It has a mask, so mostly the person more like inhales the steam that is coming because it creates steam, humidified air. Then there's an inhaler, as I just mentioned. Okay, usually they are used this way. This is a nebulizer, you put it. There's usually medication that is put there. It could be salbutamol or piclofenazone, which is a corticosteroid. Even here, most likely salbutamol, because it is a short acting, it acts faster. So in case of asthmatic attacks, it's going to act faster. Otherwise, for the long acting medications, like let's say leukotriene modifiers, those are basically used in the management, long-term management of asthma. So now when you're looking at the nursing management of someone who is asthmatic, and the nursing management, we can use the mnemonic that we call eprophenema. So eprophenema, prophenema. Okay. A prophenema. So this a prophenema approach is simple and straightforward. You can manage each and every condition using this, but of course you need to modify it depending on the condition that this particular patient is suffering from. For example, when you're talking about environment is for everyone. This just make sure that I'll make sure the environment is clean and neat for easy observation and everything, you understand. Okay, so we talk about environment. I would admit the patient in a clean and well-lit environment, just like that, for easy observation and everything. Then from there, you talk about the positioning. Okay, positioning of the patient. I'll position the patient in a comfortable position or their preferred position to make sure that they are comfortable. On the management of prophenema, I'm just going to send something in our WhatsApp group so that we know this particular approach. Then we also talk about rest. The rest of the patient is very much important. Then also observation of the patient, very, very, very much important. Okay, so this is the prophenema approach. I just wanted to demonstrate on how it goes. So this is the prophenema approach, and the rest here are there: environment, psychological care, rest, observation, pain, hydration, elimination, nutrition, education, medication, advice on this chart. So you just simply explain at least about 3 to 4 points on each and every parameter about the environment. A clean environment, a well-lit environment, an environment of good temperature, an environment of free from allergens, because we are talking about asthma. Psychological care. I will explain each and every procedure that I'm going to be doing to the patient to allay the anxiety. I will introduce the patient, I will orient the patient throughout the ward environment, just like that. I'll ask for permission before performing any procedure. Rest. I will allow the patient to rest to promote healing. Observation. A lot of observation. In case of difficulties in breathing, mucus production, wheezing, and everything. Pain. How are you going to manage pain? For example, maybe in case of relaxation techniques like deep breathing and everything. Hydration. Make sure that they take enough air. Elimination. The nutrition, you talk about food. Education, I will educate the patient about medication, the importance of taking medication on time. Then medication, I will administer prescribed medication to promote healing. Then advice on discharge. This one you can just talk about it. Then the continuity of care. And this is basically what I just wanted us to discuss about the asthma. I hope it was helpful. In case we have challenges or missing, kindly comment in the comment section or reach out to my WhatsApp line that has been provided in the comment section. Thank you very much.